ceded traditional territory of the Algonquin and Anishinaabe people. This land has sustained Indigenous communities for generations, and they continue to care for it today. As chair, I commit to strengthening partnerships with Indigenous communities and ensuring that public health decisions reflect Indigenous voices and knowledge. Together, we will work toward health equity and cultural safety in all we do. As we close out the year, let us carry forward these commitments with purpose, building systems that respect Indigenous rights and create space for healing and hope. Can I have the roll call, please, Madam Board Secretary?
Member Bauer?
Present.
Member Carr?
Present.
Member Chung?
Present.
Member Dudas?
Present.
Member Gower?
Here.
Member King?
Here.
Member Ejiofor?
Present.
Member Grudenwald? Member Bradley?
Here.
Vice Chair DiGiovanni?
Present.
And Chair Kitts?
Here.
We have quorum.
Thank you so much. We do have regrets tonight from Member Grunwald. Are there any declarations of interest? Seeing none. Confirmation of minutes of the meeting of November 3rd. Are these minutes confirmed? Thank you. We have one communication item that is on file with the Board of Health Secretary. Motion to introduce reports, Vice Chair DiGiovanni.
Be it resolved that the Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, and the reports titled 2026 Draft Operating Budget for the Ottawa Board of Health, Ottawa Public Health Strategic Plan for 2023 to 2027, update from quarters 2 and 3 of 2025, 2025 Operating Budget Q3, Board of Health for the City of Ottawa Health Unit Status Report, and the IPD titled Health Canada Funding, Health Adapt Project, update be received and considered.
Is this carried? Wonderful. Thank you. So we'll go through the agenda. Item 8.1, Chair of the Board of Health Verbal Report will be held for my verbal. Item 8.2, Medical Officer of Health Verbal Report will be held for Dr. Arneson's verbal. 8.3, 2026 Draft Operating Budget for the Ottawa Board of Health will hold for a comment from me and questions. Item 8.4, Ottawa Public Health Strategic Plan for 2023-2027, update from quarters 2 and 3 of 2025 will be held for a comment from Dr. Arneson. Item 8.5, 2025 Operating Budget Q3 Board of Health for the City of Ottawa Health Unit Status Report. Is this item received? Thank you. And item 9.1, Health Canada Funding, Health Adapt Project Update. Is this item received? Wonderful. Thank you, everyone. So we'll go back to item 8.1, Chair of the Board of Health Verbal Report. So again, good evening. Kwe, Anin, Shekan, Tanchi, Unukut, and good evening, everyone. Earlier in November, I had the pleasure of joining Mayor Sutcliffe, Councillor Luloff, and Dr. Arneson on a tour of OPH's newly opened dental clinic at Peter D. Clark Place in Orleans. This clinic provides preventative and emergency care services for residents who may have difficulty accessing dental care and are enrolled in support programs such as Healthy Smiles, the Ontario Seniors Dental Care Plan, Ontario Works, or the Canadian Dental Care Program. Il a été merveilleux de montrer à mes collègues du conseil l'excellent travail que notre équipe de soins dentaires accomplit dans la communauté. Cette nouvelle clinique représente une étape importante pour élargir l'accès équitable aux services essentiels de santé bucco-dentaire pour ceux qui ont le plus besoin. As someone who grew up in Orleans, it was very special to see this clinic open just around the corner from my childhood home. I'm looking forward to OPH's presence continuing to grow in Ottawa's East End. Comme il s'agit de notre dernière réunion de 2025, je veux prendre un moment pour réfléchir au travail de ce conseil au cours de l'année écoulée et partager certaines de mes priorités pour 2026. This has been a year of significant transition. We began 2025 by saying goodbye to Dr. Etches as OPH's Medical Officer of Health, welcomed Dr. Arneson as interim MOH, and ultimately confirmed him as the board's choice for permanent MOH. Throughout the year, the board has had the opportunity to consider a wide range of public health issues, from the overdose prevention and response strategy and our older adult strategy to the neighborhood health and wellness hubs, beach water testing, the Healthy Babies, Healthy Children program, and many more. This breadth of issues speaks to the importance of OPH's role in the everyday lives of Ottawa residents. It reflects the vision and mission of our 2023 to 2027 strategic plan that we work together with the community to promote and protect the health and well-being of all people in Ottawa. As we head into 2026, I am mindful that this will be the final year of this board's mandate. Since our term began in 2022, each of you has provided exceptional guidance and leadership to me, to Dr. Arneson, and to the staff at OPH. In 2026, many important issues will come before us, none more critical than ensuring the long-term financial health of Ottawa Public Health, which is essential to maintaining core services and meeting the evolving needs of our community. Je suis convaincue qu'ensemble, nous établirons une voie solide vers un financement durable et que nous continuerons à renforcer nos relations avec nos partenaires provinciaux et municipaux. Ce travail est essentiel pour protéger les services essentiels et répondre aux besoins évolutifs de notre communauté. I am deeply grateful for the work each of you has done this past year, and I look forward to what we will accomplish together in 2026. I also want to express my appreciation to the dedicated staff of Ottawa Public Health for their commitment to the health and well-being of Ottawa residents. With the holiday season upon us, I hope you all have the opportunity to rest and spend some well-deserved time with friends and loved ones. This time of year can be joyful, but it can also be a time of isolation for some. A simple gesture like reaching out to someone you haven't connected with yet this year can make a real difference. If you can, take a moment to share a warm hello with a friend or a neighbor who might need it. With that, I wish you all a happy and healthy holiday season. Cela conclut mon rapport verbal. I would be happy to take any questions. Seeing none, is this item carried or received? I always get that wrong. Thank you. Item 8.2, Medical Officer of Health Verbal Report. Over to you, Dr. Arneson.
Thank you. Good evening, Kwe Unusakut Kanshi Ani. Bonjour. December 1st marks an important date for global public health as we observe and commemorate World AIDS Day. The theme for this year is Overcoming Disruption, Transforming the AIDS Response. It calls for sustained political leadership, international cooperation, and human rights-centered approaches to end AIDS by 2030. While important progress has been made in treatment and reducing stigma, there's still a great deal of work to be done. It is estimated that 40.8 million people are living with HIV worldwide, including 63,100 people in Canada. Locally, this day was marked on Parliament Hill at the Centennial Flame with a ceremonial red ribbon flag raising. I was there this morning and it was a wonderful event, although a little bit cold. At each of your desks today is a red ribbon. I would encourage you to join me in wearing the ribbon tonight to mark World AIDS Day. It was about this time last year that I learned with all of you that Dr. Etches was stepping down from leading OPH to take on the role of President and CEO of the Children's Hospital of Eastern Ontario. Taking over from Vera as Medical Officer of Health has been an incredible journey, and one that I would not have moved into so easily without the support of my colleagues in this room. I'd like to thank and acknowledge OPH's senior leadership team sitting over there on the side, as well as Chair Kitts and the Board of Health for your continued guidance and advice over the last year. I honestly could not have felt more supported over this past year. J'aimerais remercier et reconnaître l'équipe de direction principale de SPO ainsi que le président Kitts et le conseil de santé pour votre orientation et vos conseils continus au cours de la dernière année. Honnêtement, je n'aurais pas pu me sentir plus soutenu au cours de l'année passée. Each of you has brought exceptional leadership and valuable insights to this table, whether from your community experience or professional backgrounds. Your contributions have enriched our discussions, and for that, I am deeply grateful. I would like to acknowledge and thank the employees of OPH. Your compassion and professionalism are seen and felt in this city every day. Stepping into this role, the first thing you learn and appreciate is just how much all of us care about this city and the residents. Something else I've been constantly reminded about Ottawa is how big and diverse it is. And yet OPH has a presence in every corner of the city. Over the last few months, I had the chance to meet with each of you on the board individually, as well as sit down with each city council member and the mayor to learn and discuss public health priorities in their communities. From these meetings, I developed a real appreciation for Ottawa's unique neighborhoods and rural villages. As one example of this, on a single day in September, I was meeting with the councillor for West Carleton, which took me to Kinburn Community Centre near Ottawa's rural West Edge. Au centre communautaire, il y avait une exposition très visible sur l'importance de tester l'eau des puits et des informations sur les endroits où les résidents pouvaient déposer leur eau de puits pour qu'elle soit testée gratuitement. Ce qui est devenu une information cruciale pendant les conditions de sécheresse que nous avons connues à la fin de l'été, au début de l'automne. Later that same day, I met with a councillor in suburban Ottawa who wanted to discuss OPH's role in efforts to support food security and tackle health impacts of climate change. And to end the day, I was downtown discussing the potential repercussions following the end of the supervised consumption service at Clarence Street and how we might mitigate the impacts. So I did put a lot of miles on my car in that month, but it was well worth it. The blend of rural, suburban, and urban spaces truly makes Ottawa a unique place compared to other municipalities across Ontario and even Canada. This also reflects the complex nature and roles of public health in our community. That we as a board and as OPH can effectively deal with and manage on a day-to-day basis makes me proud to be part of this organization and to work with such dedicated colleagues. I look forward to continuing our work together in 2026 as we look to set OPH on a strong foundation for years to come and evolve our strategy for even greater impact. With the winter months upon us, I want to take this opportunity to share the work OPH is doing in partnership with city departments, including Community and Social Services Department and Emergency Preparedness and Protective Services, to ensure that our most vulnerable residents have access to safe, warm spaces and services to mitigate the impacts of cold. City-run services include 24/7 outreach to connect unsheltered residents with safe indoor spaces, 24/7 warming and respite services, extended hours at several day programs, distribution of winter supplies such as sleeping bags and warm clothing, activation of additional overflow shelter system beds as needed. Residents are encouraged to download the Environment and Climate Change Canada Weather Can app for real-time weather alerts and to follow OPH and the City of Ottawa on social media for updates. You can also visit our website, www.ottawapublichealth.ca/coldweather, for an interactive map of places to warm up, including city facilities open to the public during business hours. Residents who are concerned about someone outdoors in the cold have a number of options. So for emergencies, you can call 911. But to request a well-being check or transportation to shelter, we're asking residents to call 311. And for information on community sports and warm spaces, call 211. As this is our last meeting of the year, I want to stress that the respiratory virus season is well underway and is expected to be quite severe. It is important that everyone 6 months and older gets their flu and COVID-19 vaccines as soon as possible. If you live, study, or work in Ottawa, these vaccines are available at no cost. Il est important que toutes les personnes âgées de 6 mois et plus reçoivent leur vaccin contre la grippe et la COVID-19 dès que possible. Si vous vivez, étudiez ou travaillez à Ottawa, ces vaccins sont disponibles gratuitement. You may have heard concerns about flu vaccine mismatch in the news, and although this is something that we will continue to monitor and may impact the healthcare system this season, the message for individuals is clear. The vaccine is safe and your best protection against the flu, especially for older adults, children under 5, and those with certain medical conditions or problems with the immune system. Even a poorly matched vaccine can reduce severity and outcomes. The mismatch concern is based on a single vaccine strain, and other strains in the vaccine, including the one that often causes severe symptoms in young children, may still be highly protective. If there are questions about these vaccines, we encourage everyone to visit ottawapublichealth.org. I hope you all have a restful and happy holiday season and enjoy this festive time with friends, family, and loved ones. J'espère que vous passerez tous une saison de fêtes reposante et joyeuse et que vous profiterez de ce temps festif avec vos amis, votre famille, et vos proches. This concludes my verbal report. I would be happy to take any questions.
Not seeing any questions. So is this item received? Great. Thanks, everyone. So we'll move on to item 8.3, 2026 draft operating budget for the Ottawa Board of Health. And before we begin tonight's budget deliberations, I want to reiterate why we are asking for added provincial support. Ottawa is a growing city with unique challenges. In just 14 years, our population has increased by 21%, one of the fastest rates in Ontario. People are coming to Ottawa from across Canada and around the world. And with that growth comes more complex public health needs. As Dr. Arneson noted, Ottawa's mix of rural, urban, and suburban communities is unlike any other. Our boundaries could fit Canada's 5 most populated municipalities inside them. Ces réalités exercent une pression réelle sur la capacité de santé publique Ottawa à servir les résidents. The province has acknowledged through the Ottawa Deal with the city that Ottawa is a unique place within the province, and its contributions deserve special recognition. We know we have a responsibility to use the resources entrusted to us wisely. In 2023, OPH completed a service review that identified $9 million in savings by streamlining services and aligning them with provincial standards and community priorities. We reinvested those savings into health equity, infectious disease response, and environmental health. In this budget, OPH has found ways through staff gapping, partner funding, and efficiencies to ease some pressures. Malgré ces économies, nous sommes confrontés à des importantes contraintes budgétaires. Currently, only 58% of our budget comes from the province. The province has committed to restoring the 75-25 cost share ratio. We welcome that commitment and look forward to working together with them. Until that plan is in place, we need additional provincial support. That's why this one-time request is included. As the province reviews funding models for public health units, I'll continue to advocate for these 3 commitments for OPH. 1, restore 75% provincial funding for mandated services. 2, annual base increases to reflect 3 to 4% growth in costs. And 3, new investments to meet the needs of our growing diverse population, especially newcomers. I want to thank OPH staff for their hard work and Mohamed Kibria and his team for guiding this budget process. Despite funding pressures, they continue to deliver exceptional service to Ottawa residents. So thank you. Merci. We'll now open it up to any questions to staff. Member Bauer, you'll be up. We're just going to give Kibria a moment to get seated here. Great. Thank you. Fire away, Member Bauer.
Thank you, Chair. And thank you again to staff for the very thorough briefing. We had our last board meeting. It really laid the groundwork for our considerations tonight. I have one minor question that came to my mind in light of the risk register that we received at our last board meeting. There was in the budget documents a noted drawdown of the OPH IT reserve of over $600,000. And in light of the technology risks that was highlighted in the register that we received, just wondering the implications of that, if any at all. And my second question perhaps is directed to the Chair and the Medical Officer of Health. I mean, do we have a timeline, any insights on the timeline of when the provincial funding formula review will be wrapped up? I mean, it's been sort of launched since 2023. So just wondering if there are any sort of insights about timelines of when we can expect a decision.
Thank you so much for the question. When it comes to our current balance, actually, in the IT reserves, we have $1 million balance. On top of that, we are anticipating to contribute $200,000 this year. We are planning to withdraw $600,000, which will leave us with $600,000 balance. According to our analysis, which is pretty good, we looked at our need over the last few years, how much we withdraw on average. It's around 275,000. So this year we are withdrawing additional funding. The reason why we are withdrawing additional money is to expand our electronic medical records, and we are pretty confident that if we have additional licenses for TELUS CHR and Hedgehog, that will pretty much cover the need that we have, and that will also improve the cost efficiency in terms of staff timing allocated for manual documentation. So it is a good investment to improve cost efficiencies too. So risk-wise, I'm very confident that we will have a good amount of balance remained in our IT reserve.
Yeah, just to add we are budgeting and planning around that risk and the need to evolve our IT strategy is something that we're discussing and certainly will become part of the strategic planning discussions as we head into next year and Board of Health changeover in 2027. The labeling of it as an IT reserve might also be related to historically how we can have reserves in a budget, specifically for certain things. I'm not an expert on this, but I recall in the past there were discussions around the ability to have reserves for these challenging situations for the budget that were marked for IT, but that doesn't necessarily restrict us from allocating funds as necessary for IT projects. They don't have to come specifically from that reserve. In terms of your second question, it's a really very important question, and thank you for bringing it up because we have been hearing about a funding formula review for a couple of years. The most recent updates we have are that that funding formula review is looking at a multi-stage process that likely wouldn't involve specific funding changes imminently. So we don't actually have any timeline right now of when amounts of money might change. So we need to start thinking about long-term financial planning, and Kabir and I were discussing this before the meeting today around how we plan for the future, assuming that there isn't a major change in how our funding is in the coming years. There may be, but it does not seem like we're going to get anything imminent as to this is how things are going to change in the short term, or really in early part of 2026. So yeah, right now we really don't have a timeline for what the true funding formula, and I'm talking about the sort of dollars and cents part of the funding formula review is going to be wrapped up or come to a conclusion. There's still a lot of sort of groundwork around the periphery of how boards spend money and so forth that is going to be part of the next steps that the government's taking.
Maybe I'll just add as well that I will be going to Roma, the Rural Ontario Municipalities Association conference at the end of January, and hope to meet with the Minister of Health again, and we'll be asking that question. So hope to have some news to report back to the board early in 2026, hopefully. Thank you. No more questions, Member Bauer, you're good. Member King, please.
Thank you, Chair. And once again, I really want to thank the staff for the amount of work that they're doing, not just in presenting this budget to us, but obviously the continuity of service, despite the fact that we have a lot of structural problems in terms of our funding with our provincial partner. Reviewing the information is really impressive. The 66,000 vaccine doses to protect our children, dental care for over 7,000 residents, including 3,000 seniors. 8,000 home visits and support for new families. I'm also, of course, always very impressed with the services that are provided through our neighborhood community and wellness hubs, and want to see the continuity of those services. So I don't want to just thank you for the hard work and staff, but just generally the whole organization. In order to deliver these services, we need people. And the budget maintains 511 FTEs with no increases since 2021, despite population growth and new program requirements, such as the Indigenous Health Branch. So I'm just wondering if you can answer, how is OPH managing increased demands with flat staffing levels, and what work is not being done as a result?
Thank you so much for that question. I will reflect on three key strategies out of many we tried to apply it over the years. The first one started actually back in 2021, when we started thinking about a comprehensive service review that we have done and concluded in 2023. We are one of the first city department who decided to do this comprehensive service review. Through the service review, we identified $9 million worth of cost efficiencies. Now, we had a question in our mind, what do we do with that? We could actually address our budget pressure by cutting cost, but we could also have a choice to invest this money to address the growing and complex need that we see in Ottawa, as you rightly mentioned. And we decided to do that. We created a new department called Health Equity and Diversity and Inclusion Department. We also created 10 neighborhood wellness hub, as you mentioned. These are new service areas actually we added by finding actually cost efficiencies. So one of the strategies that really worked for us, that although we did not grow by numbers in terms of FTE, but we could find cost efficiencies that we could reinvest actually to expand the service. Number two strategy that I want to highlight is that when it comes to staff gapping, we are very strategic. We tend not to keep one position vacant throughout the year. We try to spread it out. And we have a pretty robust process of having a conversation with all managers and spread out the gapping in such a way that doesn't affect one particular area. The third strategy that really worked for us is our taking the advantage of our technology. We automated many of the processes that actually saved our FTE times. One such example is that we transformed our school health program into a online platform that saved a lot of staff time actually when our staff used to go to a school and do more in-person interaction. We automated some of the business processes that saved 4 to 5 FTE time. That's another strategy. And the last one I want to highlight is that we brought a report to this board last year. Last year, I remember that we adopted a risk-based approach for health inspection of some of the food premises, high-risk food premises. And we had to do it because we don't have enough resources to inspect all the food premises that we want to do, or as frequently as we want to do. So we had to identify high-risk premises that we want to prioritize. So that prioritization continued to work for all service area, I would say. On top of that, we continued looking for cost efficiencies by reviewing it line by line budget. And as you have noted, actually, this year also, we found $365,000 cost savings. So in a nutshell, we were very creative. We are working smarter, I would say, and I appreciate the entire OPH team for taking so much on their plate actually to find efficiencies and address the growing service need within these limited resources.
Well, I can say without a doubt, as a member of the board, I really do appreciate the fact that you are finding these efficiencies and revenue offsets through staff gapping, through found operational savings, through secured partner revenue, and through utilizing reserves, especially the IT reserve, very prudently. And it's very important, obviously, because of the pressures in terms of not receiving the amounts of injected dollars from the province that we should. I do have one last question. The report states Ottawa taxpayers are funding approximately 14 million more than the intended 25% municipal share. So I'm just wondering for future budgets whether it would be possible to express this in a per household term so residents can understand the impact. For example, what is the annual per household cost attributable to the provincial funding shortfall? I think it's very important for us to actually have a clear representation in terms of the impact on the tax bill. So I was just wondering if staff would have the capacity to do that in the future. Obviously, you can't probably do that on the fly now, and we can't have that in the document today, but I'm just wondering if staff would be willing to commit to providing those types of numbers in the future.
Thank you for the suggestion. Yes, of course, we are actually planning to bring a long-range financial stability plan to this board. We started having this conversation with our financial planning department, and we believe that this is the time to bring this plan. It's a 10-year plan, and part of that plan would be to really cost it out, that how much it costs to deliver public health services in Ottawa, how much it costs per capita, and how much the taxpayers are actually paying compared to the provincial funding. We would be happy to bring that kind of analysis to this board.
Well, I really do appreciate that. The province has committed to funding 75% of cost-shared mandatory public health programs. The reality in Ottawa is that they're only funding 56%. And that 19% point gap represents approximately $12 million in unfunded obligations, costs that are frankly being downloaded onto Ottawa property taxpayers. And that's why I think it's important for us to really clearly articulate what that cost is. Notwithstanding that, this budget is sustainable in the short term, but not without provincial action in the long term. That's why I strongly support the work that you've done in this budget, and we also strongly support the work of our chair in terms of her advocacy, going to Roma and going to other venues. We do appreciate that because we have to go beyond these one-time funding injections and efficiencies. And ultimately what we need is sustainable annual base funding increases from the province. So I'm really thankful for the work that public health undertakes in terms of the prevention, in terms of being cost effective, in terms of providing essential services to our residents. And we know that every dollar we invest prevents multiple dollars in downstream healthcare and social costs. So in terms of really improving results for Ottawa residents, we'll continue to advocate for more resources from the province. Thank you, Chair.
Thank you very much, Member King, for those comments and for that suggestion. I am very much looking forward to that longer range financial plan. I think it'll help tell the story to Ottawa residents about the situation that we're facing. So thank you for that. Member Gower.
Thanks, Chair. I was actually going to ask just a clarifying question relating to longer term. The report notes the 3 to 4% growth in operating costs needed to sustain existing services. Within that number, does that include projected increase of services due to growing population in Ottawa? Is that all part of that 3 to 4%?
Thank you for the question. No, it's not part of that. It is just to maintain the status quo, I must say. Part of our long-range financial plan has multiple scenarios in consideration. One is to maintain the status quo. Other one is also to consider the the population growth and the growing demand for services. So we will bring all different options to the board, and we are planning to engage our board members in the conversation to decide collectively that what makes sense for Ottawa residents.
Okay, thanks very much. That's all my questions, Chair.
Great, thank you, Member Gower. I'm not seeing any other hands, so I will read the recommendation that the Board of Health for the City of Ottawa Health Unit, 1, approve Ottawa Public Health Strategic Action Plan as outlined in document 1. Oh, my goodness, I'm reading the wrong one. My apologies. I'm getting ahead of myself. That at its meeting of December 1st, 2025, the Board of Health for the City of Ottawa Health Unit, 1, approved the 2026 draft operating budget for the Ottawa Board of Health. 2, upon the Board of Health's approval of the 2026 draft operating budget for the Ottawa Board of Health, direct staff to forward the report to Ottawa City Council for consideration on December 10th, 2025 as part of City Council's approval of the City of Ottawa 2026 draft operating budget. And 3, upon approval of the 2026 draft operating budget for the Ottawa Board of Health by the Board of Health and Ottawa City Council, direct the medical officer of health or delegate on behalf of the Board of Health to forward the 2026 annual service plan and budget submission to the Ontario Ministry of Health for consideration based on the approved 2026 operating budget for the Ottawa Board of Health. Is that carried? Great. Thank you, everyone. And now we will go to item 8.4, Ottawa Public Health Strategic Plan for 2023-2027, update from quarters 2 and 3 of 2025. So we're going to start with a comment from Dr. Arneson, and then we do have one delegation on this item.
Thank you, Chair. I'm pleased to provide an update on Ottawa Public Health's progress to advancing our strategic plan during the second and third quarters of this year. First, I want to highlight that we continue to make steady progress across all 5 strategic goals. Some initiatives are encountering manageable challenges, which are described in the report. These challenges are being actively addressed. Importantly, no initiatives are experiencing major challenges that threaten overall success. The report outlines minor refinements that were made to the 2026 action plan to strengthen implementation without changing the overall direction. The report also profiles recent accomplishments. Under Goal 1, Equity Driven, a health equity action roadmap was co-created with Chronic Disease Injury Prevention and System Integration Unit. The team is now applying the recommendations to further embed health equity into their work. 7 additional client-facing programs will co-create health equity action roadmaps in 2026 and 2027. For Goal 2, Create Conditions to Live Well and Thrive, OPH contributed to the new zoning bylaw and the Climate Ready Ottawa strategy, ensuring health perspectives are integrated into citywide initiatives. Under Goal 3, Promote Well-Being and Reduce Harms, we continue to see significant efforts on naloxone distribution. Following the closure of OPH's supervised consumption services at 179 Clarence Street, OPH remains committed to supporting individuals who rely on harm reduction services by continuing to offer naloxone training and distribution, harm reduction supply distribution, sexually transmitted and bloodborne infection testing and treatment, and system navigation services at the same location. And also should be mentioned through our mobile van, which has also increased services in the community. Through Goal 4, focus on prevention, OPH contributed to the city's primary care provider recruitment and retention strategy by providing a comprehensive summary of our recent work and learnings on primary care access and attachment in Ottawa. By sharing evidence, OPH supports decision-making and healthcare planning and delivery, helping to align services with community needs and contributing to a more responsive and integrated health system. And finally, Goal 5, Enrich Our Workplaces, focused on advancing Indigenous cultural safety through experiential learning. These initiatives fostered a shared understanding of two-eyed seeing, promote cultural safety and awareness, build capacity in working with Indigenous partners and communities, and deepen employees' knowledge and understanding of the history of the relationship between Indigenous and non-Indigenous peoples. Looking ahead, we've initiated planning for the next strategic cycle. Our recent risk management report highlighted the dynamic environment in which OPH operates. Given this, OPH must remain responsive, adaptive, and flexible. Strategic planning is an opportunity to align organizational priorities with evolving community needs, while ensuring the plan is achievable within the context of high operational demands that many of our teams are facing. As we look to the future, our commitment is clear to build a strategic plan that reflects the voices of the community, empowers every employee, and positions OPH to navigate challenges with resilience and foresight. Thank you, and I'm happy to answer any questions, and I believe we have a delegation as well.
Great. Thank you, Dr. Anderson. So we will go to the delegation and then open it up for questions. So we have Rob Boyd. Just turn your mic on.
Right. I do want to start out by acknowledging the heroic efforts of Ottawa Public Health staff back in 2017. Just as we started experiencing the escalation of the opioid crisis into the toxic drug crisis, OPH stepped up, and within a weekend, I think, some of my colleagues at the time are here, opened up a supervised consumption site, the first sanctioned site here in Ottawa. And Ottawa Public Health has continued to lead this community around the area of harm reduction in the toxic drug crisis ever since. So thank you to, and I think Kira was involved at the time as well. So my name is Rob Boyd, and I have been over the past 35 years working in this space of homelessness, mental health, and substance use health here in Ottawa. And I'm currently the CEO of Ottawa Inner City Health, which provides 24/7 healthcare for individuals, homeless individuals with complex healthcare needs, both within homeless shelters and supportive housing programs selected throughout the city. We also operate the trailer, which is the only 24/7 consumption site, I believe, available in Canada, certainly in Ottawa. And have portable outreach and case management services staffed by people with lived expertise of homelessness, substance use, and mental health challenges. So I was on the ground when the opioid crisis started around 2010, and this is my World AIDS Day ribbon that we created in 2010 that I saw on my desk today, and I thought very appropriate to bring today to mark the amount of time that we have been dealing with this crisis, and we've not seen it abate in any significant way since 2010. Back then, we were advocating for the best evidence-based treatments for opioid overdose risk, which was take-home naloxone, low barrier access to opiate agonist treatment services, and supervised consumption. However, the shift that happened in 2017 towards the toxic drug crisis fundamentally changed the fight that we were in, and we have not been able to pivot and adapt based on the shifting realities of what was happening on the ground. For instance, we saw a lot of people shifting towards smoking away from injecting at this time, and we've asked repeatedly, and we're told that we were not allowed smoking within the sites. We've asked for injectable opiate agonist treatment services for those who have treatment refractory opioid use disorder, and those have been denied as well. And what's happening because we haven't been able to pivot is that we've been set up for failure, and there's a sense that people have out there a growing concern that harm reduction services are not only not working, but they're actually the cause of the social disorder that's happening downtown, without identifying that this is actually the toxic drug crisis and the housing crisis combining together in downtowns throughout the country. The closure of the Somerset West CTS, the OPH site, Sandy Hill Community Health Center has recently announced a reduction in services starting on January 1st, creates grave concerns for me about the impact that this is having on our clients and on the neighborhoods. We've seen the impact of the Somerset West closure with an increase in public drug use, not only in their area, but in Centertown area, as people move to the next available location to access harm reduction gear. Closing consumption sites does not mean that people will stop using drugs. They will just stop using them in consumption sites. While I'm cautiously hopeful about a new investment in substance use treatment, my worry is that those who experience the most barriers to treatment will be left behind once again, and we will not see any change in our downtown core. It's important to understand that people who experience these barriers to recovery are actively screened out of the treatment system as it stands today, because the system assumes that people have some degree of recovery capital for the treatment. Otherwise, the treatment will fail them. So it does not make sense to send someone to treatment only to return them to the environment that is driving their substance use in the first place. My favorite definition of recovery is that recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, strive to reach their full potential. It is supported by 4 key dimensions: health, managing symptoms and making healthy choices; home, having a stable, safe place to live; purpose, engaging in meaningful daily activities; and community, having supportive relationships and social networks. To support recovery for marginalized people who use drugs, we need to focus on these things first. And this is what we've been doing with our housing and shelter partners over the past 25 years. Ottawa Inner City Health we focus on these things through direct healthcare, our supportive housing, our block leader program, our peer outreach and case management services. We are treating people where they're at through community development opportunities with block leaders or residential peers, and having recovery-oriented conversations using a peer recovery coaching model called the Life Process Program.
Rob, you are at time, so if you could just quickly wrap up.
Last thought. Yeah, thank you. We have to stop thinking about sending people to treatment and think about innovative ways to send treatment to people in doses they can tolerate. And we need to actively remove barriers to the recovery by providing them with hope, purpose, and housing. Thank you.
Thank you very much. Do we have any questions for the delegate? You do have some questions. So Member Gower.
Thank you, Chair. And thank you, Rob, for your delegation today. I have a tremendous admiration for the work that you and your team do. It's incredibly valuable to our community. You're presenting here tonight in the context of Ottawa Public Health's strategic plan update. Specifically, where what support do you need from Ottawa Public Health, or how should our strategy or focus, how does it need to change to better support the issues that you're encountering?
Thanks for the question. So I think what I appreciate about public health and this plan is that it does really focus on that population health level and looking at, I think that there's a lot of alignment between how we see recovery and the public health approach to healthcare. So, you know, we want to continue to work with public health around those areas, those social determinants of health that are actually actively preventing people from getting the care that they need. So, you know, conversations about inclusion of recreation, meaningful employment, all of the things, if you think about what's in the prevention plan or what prevents people from developing substance use disorder in the first place, are the same things that we need to build in place. So I think continuing to go at this somewhat indirectly. I mean, one of the real challenges with fentanyl is that if there's nothing to compete with it, it's going to win every time, right? It's bigger than us, stronger than us, faster than us. So we really got to think about how is it that we're going to work around that issue so that we're supporting people with alternatives to their drug use. And we've seen that. We've seen the success of people change their relationships with drugs just by having an opportunity to participate in our block leader program or to get involved in some housing and to really begin to start connecting back to their community.
Okay, thank you very much. Thanks, Chair.
Thank you, Member Gower. Member Bauer.
Thank you, Chair. And hi, Rob. Good to see you again. I echo Councillor Gower's comments on your leadership in the community and your team's leadership. And I know we go way back to Sandy Hill and then even before that to the AIDS response here in Ottawa. So thank you for being here tonight. I have a similar question to Member Gower. We struggled somewhat as a board and as an organization for the past few years on what is an appropriate leadership role for public health vis-a-vis our other community partners, our other City of Ottawa departments. Our current iteration of the opioid overdose response strategy has sort of a diffuse model recognizing roles and responsibilities across the city. I'm just wondering from your perspective, are we structurally set up for success in terms of where the response needs to be given its evolution that you described tonight? Or do we need to start thinking about in our next strategic plan and a different way of leading or supporting the response citywide?
Well, that's a big question. So, I mean, and it's really challenging because I don't think anybody's really figured this out in terms of what actually would be the successful model. And we definitely need all levels of government kind of pulling in the same direction, right? We saw how successful that was with COVID, and we need that same level of response for this. And part of the challenge is that there has not been the scale of investment that was actually needed to deal with this problem, even in its infancy. And so we're really behind. So trying to figure out how it is that we're going to actually set ourselves up for success is a bit challenging. However, I do believe that we need to start working with people where they are on the ground right now. I do believe that we need to provide people with access to, enhanced supportive housing with wraparound healthcare supports. And if we're talking about the core of this, all of the prevention stuff that's in this program is quite critical and quite vital to it. So I think that Ottawa Public Health, the structure that we have in place, there is an overall view. So yeah, in one way it feels a little bit diffused, but on the other hand, that is what it takes. It takes having to protect the mental health of young people. And, it has to protect opportunity for people to work, has to protect housing. This is something that really, the HIV epidemic, the overdose epidemic, all of this, the issues of social disorder, all of these are related to those social determinants of health. And they're the same ones for all of them. So when people are marginalized and set aside in society, they're going to find ways of surviving that are not going to be as socially acceptable for everybody else. So we really have to look at how it is that we're building people up from the ground. And then we have to look at those who are currently lost in the system and find innovative ways to build them up as well. So I'm not sure that I see a course correction on it at this point. I just think that it's a hugely wicked issue that has been really under-resourced by all levels of government.
Thank you, Member Bauer. Member Carr.
Yeah, thanks very much. Thanks, Rob, for your delegation and for all the work that you do in the community. Just following up on what you said to Member Bauer, that, under-resourced, we need all three levels of government. Have you seen, I know you kind of work more in the market type area, but have you seen so far any results from the Heart Hub model at all? I know they've got quite a few, I don't know how many it is, 700 clients. Have you seen any successes from that at all yet, or too early, too soon? They don't have their full suite of services yet.
Yeah, thank you. Thank you for the question. I think it is probably too early, too soon. We also know that people who are using the trailer would only occasionally be using the Somerset West site. So whether or not some have gone over in that direction in order to kind of check out that services, it's difficult for us to assess given that they're anonymous services that people are using. We know from experience that people generally don't travel great distances in this community to make use of services. And again, I think that Somerset West is working, very hard to ensure that the people who get access to the Heart Hub programs and offerings are those who have been displaced by this decision to close their consumption site. But as I'd kind of outlined, that's a real challenge to do, given that this is a community of individuals who have a lot of past experience of treatment that has not been successful and have internalized that as being their failure. And so it makes it that much harder. And we have to make sure that the treatment system itself adapts to the needs of this population rather than the other way around. So I think that there is hope, and I think that it's possible, but I'm very cautious about that optimism that it's going to make an impact on the market area.
Yeah. Okay. Thanks. I wondered about that. And have you seen any impact on the trailer at all from the closing of the site on Clarence?
So it's very difficult to assess kind of impact on a short-term basis because a lot of factors go into whether somebody's going to use the site. So I looked at the average number of visits per week from September, October, and November. So in September, we averaged 596 visits a week, in October, 766, and in November, 726. So we can't say that that's causal, but we did see a jump in visits by about 200 per week after the closure of the OPH site. But again, other factors could come into that, such as what the weather is like outside, for example, where people are going to more likely come inside. So I was always cautious, even with the Somerset West closure, that we weren't really going to feel whether that was going to impact us until the winter months came along. And certainly we're anticipating the reduction in hours of service at Sandale Community Health Center to impact us directly.
Yeah, okay, be interesting to follow that trajectory as things develop. But thanks very much for coming out tonight and speaking to us.
I'm not seeing any other questions for you, but thank you very much for being here for
Okay,
delegating.
thank you.
Okay, so we will open it up to questions to staff if anyone has any. Member Bauer.
Thanks, Chair. It's more of a reflection again after our discussion at our last board meeting around risk management and reviewing the risk register. And there were a couple of risks that were really identified as increasing. They were in red. And then I, read the report for this meeting on the strategic plan, and it was sort of steady progress across all the goals, minor amendments here and there. A couple of the risks, the compliance and legal risk, number 3, rightfully flagged increasing societal challenges, more complex needs with drug toxicity, housing and mental health. We know that the food security report that the board has received as well was far more dire than previously. So I'm just wondering sort of what the relationship is between sort of our identification of risks on an annual basis and how we are adapting the strategic plan as we go along. At what point in terms of seeing these increased risks, do we change sort of the action plan to adapt to what we're seeing on the ground? It's sort of the interaction between a risk management framework and our strategic planning process. Again, maybe more of a reflection for our process to come in 2027.
Yeah, thanks for that. I think these are all really good reflections. I'll offer my own reflection in that doing these risk analyses for public health is challenging for the reason that you just said, which is that a lot of the risks that come out and that are clear are real, whole of society challenges. I mean, I think that was mentioned when we look at our strategic planning and what we're trying to do. We're trying to address some of the most serious societal challenges when we're getting at things like the opioid crisis, like housing and aspects around education and homelessness prevention, but also literacy and understanding health information, that type of stuff. So certainly, I think when we look at the strategic plan that was made by this board, I think we don't look at these issues in isolation. Like many of the goals cover many of the aspects around the opioid toxic drug crisis and cover many of these social determinants of health. When we actually do the risk process, as I said, it's kind of challenging to sort of say these risks, which are continuing broad societal risks versus our risks as a corporation or business, which is really what those are sort of, that's what the structure of a risk registry is sort of set up for. So we try to sometimes have things that are a little bit more specific to our day-to-day business and day-to-day operations in there. But we have, it is the same individuals, some here in the audience, who are looking at these things in conjunction. And then each goal team is looking at these individual risks to change their action plan on a frequent basis. And yeah, I think I'll just ask Cameron Keys if he wanted to add anything more about how the risk relates to the strategic plan and how he sees it, how he sees the interrelationship between the two.
Yes, thank you for the question. So from start with a process perspective. So when, we have a strategic plan, and what we do is we have something called a strategic steering committee. And so they oversee the 5 goals. So we also have a team of multidisciplinary people for each of the goals. And every quarter, the strategic steering committee gets together and we talk about progress, achievements, challenges. And twice a year, we reflect upon our risk registry. So absolutely, it's embedded at the beginning when we build a plan. It's embedded, throughout each and every year a few times. Our strategic plan does get modified each year as well, sort of our action plan for each goal. So I think there's opportunity. Without a doubt, there are some things, like IT, for example, that wasn't in our strategic plan. I guess we were hoping for a little bit more provincial and city help, as it related to technology, 3-4 years ago than we actually have received. And so what we're doing right now is we are forging a path. So we have a mitigation plan for each of the risks. And, for example, for technology, we're thinking, well, we can't sit on our hands. We have to maybe solve this ourselves. And so that will very much likely be part of our next strategic plan. So that's an example. But from a process standpoint, they are heavily embedded together. Not everything is strategic. Some things are done, from an operational standpoint. But yeah, without that is absolutely the idea. The two are not silos.
It is a good reflection that, this is a big opportunity, and strategic planning is often anchored in sort of the strengths of the organization, opportunities, but also the challenges and the information that we've gained from the risk analysis and the risk register. But I think we should think about having a bit more of a separation between sort of broader overall risks to our strategy as a whole and these broader challenges versus some of the more specific, IT system failures or cyber security incidents or privacy incidents, those which are a little bit of a different category. It might be a good idea to do that, separate that out explicitly in the next round of strategic planning. But thanks for the reflection.
Thank you very much. Member Gower.
Thank you, Chair. Okay, there's a note in the report about the lack of centralized socio-demographic data that is a challenge. And I was wondering if there is an entity or organization that should be doing that and they're not doing a good job, or if it just doesn't exist, or if it's something OPH is considering working on with partners or otherwise. Could I get some more context about that note?
Yeah, so that's a really great question. So there isn't one entity that's involved in it. I would say that that this is a movement that has been growing in recent years and was expedited by the pandemic. And Ottawa Public Health has been a leader in the public health space on this, which is basically that we need more information on socio-demographic data, which to inform health equity. So to inform the services that we're providing and ensure and monitor that they're being delivered in an equitable way and that there aren't major gaps. So this is a hugely important initiative, but it's also a fairly large initiative, and we've it's under Vera's leadership. The Quest team put a lot of effort into looking at our services and how we can collect this information. At the provincial level, when you're talking about hospitals and the healthcare system writ large and primary care and so forth, I would say this is it's very early stages. You might say that it's not where it should be at all at this point in 2025, but Ontario Health does have some leadership in this area. But I would say in the healthcare system in general, there's very little social determinants data collection happening. But we're working with the local Ontario health teams to try to champion that and push that forward, and we've been doing that for a number of years. And also, we're expanding our collection of STD data for public health services as much as we can. We have a strategy to do that. Just met with again, it was Cameron's team that works on that, and we just met last week on this. So definitely moving that forward. And Cameron, maybe you want to add another note, or maybe I covered it all.
I think you've done a great job answering that. At the provincial level, social demographic data is just it's not built into these provincial systems. So that's a problem. I think it will change. But as it stands right now, that's not the case. That leaves it to us. So if we had just one, electronic health record, it would make things a lot easier. We're not there yet. So we're building this out. We have a strategy. We started. We're going to move it out. So in the meantime, we go team by team by team to determine the best way to collect this information. If they have a system, fantastic. And for the information systems we have, we can collect this information. If they don't have a system yet, then we find ways to make it happen. So yeah, we have a lot of work to do, but yeah, it would be great if we could get more assistance, with provincial systems. But I believe, over our next strategy with the implementation of electronic health record across public health, we're gonna make big inroads. But fantastic work has been done to date. We just have a long way to go.
Yeah, thank you. Coincidentally, this is the second organization that I've seen a report from that mentioned the challenge of collecting and accessing socio-demographic data. The other one was Ottawa Community Housing in relation to some of their trying to better understand their clients. So obviously it's really, really valuable data for organizations to be able to access and prioritize and focus services. So be interesting to see how this area evolves. And I'm glad you're working with the Ontario Health teams as well. Thank you.
Thank you very much, Member Gower. Not seeing any other hands, so I will read the right recommendation that the Board of Health for the City of Ottawa Health Unit 1 approve Ottawa Public Health Strategic Action Plan as outlined in Document 1. 2, receive for information Ottawa Public Health Strategic Plan for 2023-2027 update from quarters 2 and 3 of 2025 as outlined in Document 2. Is this item carried? Sure. Great, thank you very much. We have no in-camera items. Motion to adopt reports. Vice Chair DiGiovanni.
Be it resolved that the Chair of the Board of Health Verbal Report, the Medical Officer of Health Verbal Report, and the reports titled 2026 Draft Operating Budget for the Ottawa Board of Health, Ottawa Public Health Strategic Plan for 2023 to 2027, update from quarters 2 and 3 of 2025, 2025 Operating Budget Q3, Board of Health for the City of Ottawa Health Unit Status Report, and the IPD titled Health Canada Funding Health Adapt Project, an update, be read and passed.
Is this carried?
Carried.
Thank you. We have no motions requiring suspension of the rules. Are there any notices of motion? Seeing none, confirmation bylaw. Vice Chair.
Be it resolved, the confirmation bylaw number 2025-8, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of December 1st, 2025, be read and passed.
Is carried?
Carried.
Thank you. Do we have any inquiries? Seeing none, the meeting is adjourned. Our next meeting is Monday, February 9th, 2026 in the new year. So have a fantastic holiday season, everyone. And again, thank you for a great 2025. Have a good evening.
Thank you.